Hello, my name is Gary Bain from The Wound Guy. I would like to welcome you to Wound Awareness Week 2023. Since 1987, I've had the privilege of caring for people who experience wounds. I've had opportunity to do this as a registered nurse in numerous healthcare settings and in different countries. In 2016, I began working within a rehabilitation hospital. It is in this environment that I have truly seen superb collaboration between members of the multidisciplinary team, sharing their insights, vision and skills. Since the patient is placed at the centre of the team's planning, action and evaluation, it has actually allowed me to better comprehend how a wound is in fact a prism through which I can gain a better understanding of the whole person. Collaboration has proven to be the key to improving a person's well-being and quality of life. It has also been a mechanism for my own growth and professional development. Collaboration is also the pathway to fulfilling the 2023 Wounds Australia Wound Awareness Week theme. Let's get wound care right, the right diagnosis and the right treatment at the right time. It is also at this time of Wound Awareness Week that I am exceptionally pleased to announce an educational collaboration that has begun between the Wound Guy and the Wound Educator. Once more I see that the best of endeavours are those that are shared. Thus, it is my privilege to introduce you to Lucy Sheehan, the Wound Educator.
Thank you, Gary. It's my absolute pleasure to collaborate with you during Wounds Awareness Week 2023 and to help spread the message of getting wound care right. I agree that one of the key elements of getting wound care right, the right diagnosis, the right treatment at the right time, is to look at the patient as a whole, practice evidence-based wound care, and to refer on if it's something that's not within our capacity. As pharmacists, we often don't get a lot of education in wound care through university because wound care is such a specialized area. So we often rely on the knowledge of our senior colleagues, allied health professionals, and pursuing further education. And what inspired me to pursue that is when we did a training workshop with Professor Jeff Sussman, and it really made me realize how little I knew about wound care, and that helped me pursue further education and the wound care postgraduate degree, and that helped me gain an insight into the world of wound care and allow me to be able to help patients in the community that come into the pharmacy. My vision now is to improve wound care literacy in the community and reduce harm caused by wounds. Now, I'd like to pick your brains, Gary, on a couple of questions. My first question is, what made you pursue further education and teaching in wound care, and how did you create your Woundiverse?
I've had the great fortune throughout my professional career of being surrounded by great mentors, people who had incredible experience, insight, compassion, and a desire to share their knowledge. They always had their patient's best interest at heart. They were and still are my role models. It is in recognition of their legacy that I've also sought to be a teacher. I believe that people who experience and live with a hard-to-heal wound need a healthcare tribe around them so that they can attain their best quality of life. Their well-being is so much more than the wound and a dressing. A challenging wound impacts on many factors other than just health, because consideration inevitably must extend to include the financial, social, functional, work-related and spiritual aspects of the individual's life. So when we interact with someone who has a complex wound, we actually need to think big, holistically. This is where the Woundiverse term originated. Our thinking should be big, comprehensive and inclusive.
Yes, there are certainly a lot of people who are affected by acute and chronic wounds in many ways. Chronic wounds is Australia's hidden epidemic. Over 450,000 Australians are suffering with a chronic wound, and this also costs the government aged care and health budgets over $6 billion a year. One of the biggest challenges I see in community is that a lot of patients and healthcare professionals are not confident about the treatment and referral pathways for, say, chronic venous insufficiency and lower leg edema. This means that a lot of patients go untreated or do not get referred to the right place at the right time. Unfortunately, this leads to many patients end up with a chronic leg ulcer or cellulitis that could have otherwise been prevented if prompt wound care and strategies were put in place in a timely manner. Now, Gary, what do you feel are the top two preventable wound-related conditions, and how should health professionals in the community go about educating patients on these?
See, let me show my bias straight away, as I'm a patron of the Lindsay Leg Club. Awareness is very poor indeed around lower limb and venous dysfunction and the subsequent negative consequences that this has upon a person's overall health. We really need to be reaching out to people with positive leg welfare messages, which include discussions about diet, exercise, weight control, edema, elevation, and compression. Once there is skin discoloration, varicose veins, and persistent swelling, the damage from venous hypertension is already substantial. The Lindsay Leg Club Foundation and the Legs Matter campaign in the UK have given great resources on this subject matter of venous disease. Our own National Peak Body Wounds Australia has also an excellent publication entitled Australia and New Zealand Clinical Practice Guideline for Prevention and Treatment of Venous Leg Ulcers, and this can be obtained from the Wounds Australia website. The issue of diabetes is also massive for us here in Australia. Diabetes Australia reports that around 1.3 million Aussies have diabetes, and that around about 20,000 people who have diabetes per year will experience a diabetic foot ulcer. Around 4,500 of those may undergo an amputation. This is so disruptive and costly for individuals, their families, and for our society at large. Diabetes Australia actually also state that about 85% of amputations due to diabetes are preventable. So helping these people with diabetes understand the importance of engaging in limb protective strategies is very necessary in order to reduce the rate of the diabetes-induced harm that we see. Self-care guidance can be found within the Diabetes Australia, both their website but also their call centre personnel. Great resources here. Also, podiatry oversight is an absolute must. It's ideal for people living with diabetes. All health professionals who have access to the 2023 International Working Group for the Diabetic Foot, there's clinical practice guidelines for us. They are produced and released this year so that we've got some guidance on caring for people with diabetes and with foot-related issues. If we can save feet, we'll save lives.
Thanks for mentioning those great resources and key messages there, Gary. And I agree that Lindsay Leg Club, Legs Matter, and Wounds Australia's initiatives are just fantastic. Now, I've experienced many examples in real life where collaboration has led to positive health outcomes for patients and made a big difference to their wounds. As an example, a podiatrist referred a patient who has a diabetic foot wound a few years ago, and we were able to help his wound heal through proper wound care and holistic care, and we had a great result. Now, Recently, we saw the same patient again with another wound on another toe, and he had been self-managing it for a while. So provided an initial assessment and wound care and saw some signs of local wound infection. Then did an ABPI to check for arterial insufficiency. And unfortunately, he had low arterial flow and therefore the wound was ischemic. And so I had to make an urgent referral for him to go to the hospital ED emergency department. And the patient called us back a few days later to tell us that he had the toe amputated, but had he not been referred and gone to the hospital at that time, he was told that he could have lost his whole leg. So in the end, he was quite happy that he only lost a toe. So Gary, this leads to my last question. Can you tell us an example where collaborations had led to a positive outcome?
One of my favourite clinical collaborators is with dietitians. Their input is vital in order to assist people with complex wounds and to help them progress through those stages of healing. I recently was involved in the care of a lady in her 80s who fractured the neck of her femur in a fall. Her surgical wound demonstrated a minor dehiscence that proved difficult to stimulate granulation tissue and epithelial replication, so to get it smaller and bring it to closure was challenging. The local wound care, I think, was pretty good, if I say so myself, but it wasn't enough. Enter the dietitian, who changed her food selections, the volume of food, the frequency of how she was eating, and to align all of this a little bit better with that person's own cultural sensitivities. So it means that the patient therefore had a bit more connection to a food, if you know what I mean. Then they added a short burst of supplementation and finally said, what about the hydration? How can we improve that too? Well, what do you know, after all of my efforts struggling to move forward, within 10 days that patient was 2.3 kilos heavier and the wound had almost closed. So, how good are dietitians? I love a good team approach that places the patient at the centre of all of the interactions that we engage with them.
Love that story. Thank you for sharing, Gary. Now, to find out more about Wounds Awareness Week and what you can do for your community to spread the message of getting wounds right, you can go to Wounds Australia website where you can find resources you can download and share in your workplaces and local community. Now, to find Wound Guy's valuables resources, you can go to Gary's website, www.thewoundguy.com.au. And my resources can be found on the Wound Educator page at www.thewoundeducator.com.au. You can also follow us on social media via LinkedIn, Facebook, and Instagram, and also watch this space as we create more collaborative events for our Woundiverse and wider community. Thank you for watching.